Good morning. We are live this Tuesday morning and we're going to be talking about vaping. Is it still a thing? Um, I want to remind you that we are live on Tuesday at 10:30 a.m. Eastern Time. If you're watching at any other time, you're watching a replay, and our guest will not be available to answer any questions or comments that you have, but you can put them in the comment section and dialogue with other people who are watching replay. Most people do watch us that way these days, and we thank you for that. We also welcome everybody who is live. Thank you for joining us. Our guest today is Dr. Marie Smith East. She's going to talk to us about vaping. She's going to let us know, is it less dangerous than cigarettes or more? Are there long-term effects from it? Do you still engage in it? Is it still a thing? And what should parents know? What are the trends if it is still a thing? And what should we know about this? Before Dr. Smith East comes on, I want to tell you something that I've told you many times. There are storms in my area, which means my Wi-Fi may be wonky. If it is, just let us know in the comment section and we will troubleshoot. Thanks a lot. Hi, Marie. Thank you for joining us.
Thank you for having me. I'm so excited to be here.
Why don't we get started with you telling us a little bit about yourself and your work? You have a lot of letters after your name.
I do. So good morning, everyone. I am Dr. Marie Smith East. I am an alumna of the Substance Abuse Mental Health Services Administration Minority Fellowship Program. I do have 2 doctoral degrees, one in research. I have a PhD in nursing, and then I also have a DNP, a Doctor of Nursing Practice, which is usually the doctorate degree that you get when you are a nurse practitioner as well. So I am a psychiatric mental health nurse practitioner. I'm board certified. I've practiced for many years. I own my own telemedicine practice even before COVID even hit. So just made me a little bit more busy once COVID hit. I'm also a clinical assistant professor and the current director of the psychiatric mental health nurse practitioner program at Duquesne University. I also sit on the Addictions Council of the American Psychiatric Nurses Association. And one of the topics that we published was on electronic nicotine delivery systems, which are the vaping, the e-cigarettes, which is our topic today. So I'm really excited to dive in and provide information for you all. And I think this talk is going to be helpful for parents, of course, but just anybody in general that is interested to wanting to know more. You know, it's a very hot topic right now. I think it was a hot topic, but even more so now with everything that's going on with the FDA ban and all of that. I think this will be a very interesting morning. So thank you for having me.
Thank you. You are busy. Why don't we start with telling us exactly what are e-cigarettes and what is vaping?
All right, so e-cigarettes, it's actually evolved over a period of time. I would say like if you can go online and just take a look of what e-cigarettes, if you just Googled like e-cigarettes, there's actually been so far 3 generations of e-cigarettes. The first generation started off with like Cigalikes. They look like mini cigarettes. And it evolved to the second generation that look more like vape pens. Then the third generation, they're kind of like personal vaporizers. They even have now the jewel pods also that look like a USB drive. So you can understand that could add a lot of complications, especially for our teenagers that are in school, that you may think nothing of it. Oh, it's just a little USB drive, but it's actually an e-cigarette. The actual device itself, it contains an e-liquid, which has nicotine. I think that's one of the biggest misconceptions, that people don't realize that e-cigarettes do have nicotine in it. And you actually can change that out to other stuff too. Like, so for example, marijuana can also be an e-cigarette. So that's another thing that a lot of people or even parents may not even know. It has humectants, flavorings, which is very popular amongst our teens, right? Metals, yes, there's metals in e-cigarettes that can include chromium, nickel, lead, manganese, aluminum, tin, and iron. And so a few years ago, there was like a mystery illness that the CDC put out in regards to e-cigarettes. And that has a lot to do with just the warming in that container of the all of these ingredients, right? Some of them are cancer-causing ingredients. And when they are heated up, it can cause a lot of different issues. And even till this day, it's still considered like that mystery illness that we're not really sure about what happened. But it does use nicotine salts, which allow the user to inhale large levels of nicotine more easily and with less irritation that you would actually find in cigarettes. And just for anyone that's not aware of what humectants are, the humectants are the substances in the liquid that help to aerosol the liquid when heated and gives the device the ability to mimic cigarette smoke. And there's also propylene glycol and glycerol, which are the most popular humectants as well. Propylene glycol is technically safe to ingest as food or pharmaceutical additive. However, it should be noted that it's also the substance used to create artificial fog in theaters. So long-term exposure certainly can be toxic. And that's really what a lot of the research is. And even the paper that I wrote with my colleagues in regards to this topic is that all of the major organizations are saying, well, what are the long-term effects of this? We don't really know what the long-term effects of it, and we just know what we know about the ingredients as it is. And there's just concern, especially for teens and their developing brains, the effect of nicotine on the developing brain, because we know that even just the brain itself that doesn't fully develop until 25 years of age. So can you imagine for our teens, we're here giving them this substance that can really affect their development as they, progress on as they get older as well.
So it's important to remember that these cigarettes do have nicotine. And whether or not your teen is switching out the nicotine for something else is for a different conversation, which we may be able to have time for later. But also, I'm not sure as many parents are aware that there are all those other chemicals that you listed. That's a lot.
Yes.
That's
and what I've noticed too, just in clinical practice, is that we'll have not just teens or just even young adults that'll come in and they think that, okay, well, I'm going to mix having I'll do cigarettes, but then I'll also do vaping, thinking that maybe I'm, reducing the amount of cigarettes that I'm, smoking because I'm using the e-cigarettes. But a thing that if you take away anything from our conversation today, 1 Juul pod contains an equivalent amount of nicotine to a pack of cigarettes. So even as a clinician, when I am evaluating, when someone tells me that, oh, I switched to vape pens or I, use e-cigarettes, I actually quantify how much they're smoking by asking them, well, how many of those pods do you go through? So a lot of people aren't aware of that really, again, 1 Juul pod contains an equivalent amount of nicotine to a pack of cigarettes. So if you were ever wondering, well, I think I'm doing less cigarette smoking than with my e-vaping, you can compare that to those numbers as well. And we haven't even touched the flavorings either, because there's so many studies that have come out in regards to the harm of just the flavorings themselves. So for example, I don't know if cinnamon is a popular flavor or not. I'm sure bubblegum probably is, but cinnamon, for example, there's a lot of studies that have, been done on cinnamon and its effect on the lungs. And it's very, very harmful, very harsh on the lining of the lungs. So even just the flavorings themselves, that's even another aspect of it too, that is pretty harmful. And just so you guys know, and maybe you're not aware, internationally, there are a lot of countries that completely ban e-cigarettes altogether. So it's really interesting. In one of my courses, where I actually guest lecture in a global health course, that's one of the things that our college students will say that they think is so interesting. They're like, oh my goodness, I didn't know that, e-cigarettes was banned in this particular country, because it is banned in many countries as well. So, and again, the reasoning why it may be banned is because they're realizing that we're not really seeing the health benefits as to why you would want to do e-cigarettes in general. And it's big business, right? So that's one of the things that I mentioned recently that, literally, I want to say like 3-4 days ago, the FDA had banned the sale of specifically Juul, and it's currently in an appeal. So right now it's halted for a little bit as they go through that, because they're trying to say that, oh, we have the research to support that, but it's at this time there is no there is nothing in our laws that say that, okay, e-cigarettes is an effective way to come off of nicotine. So we do have nicotine replacement therapy, like, you know, you have the nicotine patches; those are all FDA approved, but e-cigarettes is not one of them. So I think that's another misconception, that people might think that, oh, I thought e-cigarettes was FDA approved to be used as a quit device. But it actually is not.
It is not. So want to reiterate that you do not use e-cigarettes as a method to quitting smoking. They're not the same as the patch, and they are not FDA approved. You mentioned that one Juul pod is the equivalent of a pack of cigarettes. How long does it take someone to go through a Juul pod?
That's a good question. That's a good question. Some it depends. Like, I've had some patients tell me it takes them a couple of days. Sometimes they'll say it may take them a week. Some may say a day. It just depends. It varies just as much as, like, when people say that they smoke cigarettes, they might not smoke the whole pack. They might tell you, okay, I smoke 1 or 2 cigarettes a day, or 3 or 4 cigarettes a day. So it's not, it varies per the user. But it is kind of helpful to kind of quantify what that looks like. If you're just using one of those pods, you think, okay, I'm thinking nothing of it. It should be fine. But that just gives you a number of how to compare it if you had been smoking cigarettes, what that would be equivalent to.
Okay. And how does vaping affect the body?
The vaping affects the body in so many different ways. I kind of touched on this a little bit, because, again, you're creating an aerosol. So there's still so much more to be learned about that. So again, a few years ago, the CDC talked about this mystery illness that was leading to, like, pneumonia. They think they're not really sure what was going on with that even till this day. I don't believe they even know really what's going on with that. So that also makes things susceptible, right? But also the biggest thing is, like I said, the nicotine in it. It's not any different. And then again, if you switch that out to marijuana, it's the same worry that we would have if we were smoking, you know, cigarettes, and it would be the same worry if someone was smoking marijuana, right? But now you're also worried about, okay, the flavorings, like I mentioned, cinnamon, that can be very harmful to the lining of the lungs. And there's so many different studies that talk about the different flavors and how that can be harmful to the body in terms of, like, the lining of the lungs, and make you more susceptible to getting other illnesses. There's just so much that is associated with that. And then also just understanding that also in the United States of America, there are different states too that have made rulings based on the age of the person, of what age they can actually buy e-cigarettes. I know California had actually raised the age, the federal minimum legal age across it varies across states. But I know a few years ago that California actually had increased the age, I believe, from 18 to 21 years of age. So that also varies according to states as well. But I think that the biggest thing, to just answer your question in terms of how it affects the body, we're thinking of it in terms of the chemical compounds that are in the e-cigarettes, and those effects, because certain things like propylene glycol, it's not something that we would think we're going to be heating it, right? We're going to be heating it and inhaling it, right? So there's those effects that can happen that can be very harmful, and especially harmful over a long-term period. And then we also think about the flavors and toxicity, not to mention any accidental exposure, say if one of those pods open. And another very common thing, you'd be surprised, is just defective e-cigarettes, which can actually result in explosions. Just a few statistics here. From 2015 to 2017, there was an estimated 2,035 e-cigarette explosions and burn injuries presenting to the U.S. hospital emergency departments. And just so that you know that it's not just the ingredients as well, but just the product itself can be very harmful when you talk about heating this pod up, right? And you're ingesting it, and things that can go wrong, right? I think that
We have a
answers.
comment that I want you to, you did answer, thank you. We have a
Sure.
comment that I want you to address.
Sure.
It's a comment from Becky, and she says that nicotine is not the problem, it's all the tar and other toxins in the smoke.
Oh yeah, it's not just the nicotine. Absolutely. It's everything else that's in it. And I think that's one of the biggest concerns, right? Because we think, oh, e-cigarettes, it seems cool the way that they, package it. It seems really cool. You think that, oh, it smells good, right? That it's not that bad. But yes, all of those other ingredients that I talked about, the delivery solvents, the propylene glycol that can cause dry mouth and upper respiratory infections, the flavorings, depending on the different flavorings. There's so many research studies about different types of flavorings and how they can affect the body as well. And then not to mention, e-cigarette flavors are not studied for toxicity over long periods of time. So including mixing multiple flavors can certainly be more toxic to the cells than just one flavor at a time. So as I mentioned, one common one is cinnamon. Increased cinnamon flavoring can cause significant cell death compared to other flavors. So I know it sounds almost as if I'm just bashing e-cigarettes, but I hope that aside from knowing that one jewel pod is equal to a pack of cigarettes, I hope that you walk away from this just informed, that you have a better idea of what it is that you, if you are using, e-cigarettes, an idea of what it is that you are even inhaling, because I think people just assume that, hey, it has flavors, it hasn't been banned. Well, it was banned and then now it's currently in a pause. They just assume that automatically that, oh, it must be less harmful than cigarettes, or can it be that bad? Just being an informed consumer of the products.
Speaking of being informed, the amazing Jessica behind the scenes is going to put up some stats that you've provided for us for those people in the audience who are interested in learning more about the stats, like the interesting one you told us about how many people present in emergency rooms having encountered exploding e-cigarettes. But I want to kind of steer the conversation towards a while ago, we were hearing a lot about vaping.
Yes.
Is it still popular? It seems, and a lot has happened. We had a pandemic, so that kind of took over the news. But is it still popular, more or less, or what are you seeing?
Yes, that's a very, very good question. I actually remember when I initially presented on this topic, the title was Teen Vaping on the Rise, right? So it's funny because since the pandemic, or we're still in the pandemic, during the pandemic, according to the National Youth Tobacco Survey, teen use of electronic cigarettes fell sharply in 2021, which was the second consecutive year of big declines. And 11.3% of high school students, it's a decline from 19.6% in 2020 and 27.5% in 2019, report that they currently vape. Now, if we looked at this, we would think, oh, wow, vaping isn't as popular, right? But the key ingredient here is that we are in a pandemic. And what did a lot of people do at the start of the pandemic? A lot of the kids stayed home because of social distancing, right? And we do know that amongst our teens, peer influence is a big deal. A lot of kids, I know even with my own patients, some of my teens, the kids would say, well, I wasn't around that, my friends to get access to those e-cigarettes. So I would say, for this particular part of the research, let's hold off. Let's see what it's going to say for the 2022 numbers and 2023 numbers now that a lot of places are opening back up and a lot of kids are going back to school. Because these numbers, again, were at the start of the pandemic. So you would think that, okay, a lot of them aren't going to be in school. They're not going to be around their peers. And we know that they are heavily influenced by their peers as well. Good question.
Yeah, we're finding that a lot, that habits and activities that are socially influenced declined during the pandemic for obvious reasons. And so now is the time that we're beginning to understand, are they still a thing? Is there something new as everybody is out and about more? So what is it that parents should know? What is it that you mentioned, the third generation e-cigarette or vape that looks like a USB drive? Now I know what most parents should know is that teens don't use USB drives. They do everything on the cloud. So if yours has a USB drive, you may want to ask what it is, what's
Yeah.
on it.
Yes. And I think that a lot of teachers are getting pretty savvy with that too. And at least some of my patients, they've gotten caught with the USB, that's the vaping pen. But what I would say, okay, so we're talking about all of these potential problems, real issues. What are the solutions, right? So it's a very good way
Yeah.
to steer the conversation. Just be aware that youth imitate behaviors. So those who have friends or siblings that smoke are more likely to smoke. But in any event, whenever I have a parent and I have a child that comes into my office and the parent is really concerned, they're like, I don't know what to do to try to get my child to realize the harms of this or to stop doing this, right? What is research has shown to be effective is what we call motivational interviewing. And so motivational interviewing involves using their goals. What kind of goals do they have? So I'm just going to give a quick little example. So this is like a case study. So a parent presents to a clinic with their 15-year-old son, reporting that their son's been irritable, has low mood, and increased appetite. The parent reports he's been hanging around a new crowd and doesn't want to listen to anything I say, and is here for help with his behavior as he was recently suspended from school for carrying a vape pen despite prior warning. So with motivational interviewing, it has like four we call it the ORs, is like the acronym for it, where we ask open questions, we provide affirmation and support, reflections of the patient's thoughts, desires, abilities, and reasons to change, and then summaries, S stands for summaries, of the patient's histories intended to promote consideration of change. So one way to enhance motivation for change is to help the teens recognize there's a discrepancy between their future goals and current behaviors. So for example, if you had that teen that's like on the football team and he wants to be, a football star, you'll say, hey, well, how has been getting caught with a vape pen and now being suspended from school keeping you from that overall goal of wanting to be a football player or playing college football or any of that sorts? So it's really trying to hone in on what their goals are, and trying to just reflect on, okay, you say you want this, but is this helping you get closer to your overall goal? Or is it hindering you from getting to your overall goal? So that's really how we try to focus it. Every child, every teen is going to be different. But that has been an effective strategy, utilizing motivational interviewing.
Okay. And I'm going to repeat that. That was ORs. So open questioning, affirmations, reflections, and summary.
Yes. Correct.
Okay. Okay. And what questions do you get from patients or parents about this?
Well, surprisingly, from the teens themselves, they will say they had no idea what was in it, which is consistent with the research. There was a research study done by Johnson and colleagues in 2005, 2015, actually, where 30.8% thought that e-cigarettes were about as harmful as cigarettes, 4.3% thought they were more harmful, 28.9% didn't even know, and 36% thought they were less harmful than cigarettes. So that is a reflection of what I've been seeing also in practice, where majority think that they're less harmful than cigarettes. And so they're pretty shocked to know that, oh, wow, I didn't know all of that was in e-cigarettes. No one ever really told me. I just assumed as such because the marketing that you see, it's like, oh, okay, you're cool. It's a nice smell. Youth imitate behavior. So if they see like their favorite actor or, using a vape pen, or then they think, oh, it's not that bad. So yeah, it's really reflective of what we've even seen so far. In the research, that a lot of the teens are just shocked. They don't know. Parents too, they're like, oh, I wasn't really aware. Some of them think that, oh, I'm smoking cigarettes and I'm vaping, but I'm smoking less cigarettes. So I think that's a good thing. And a lot of times just like they just don't have any guidelines or any guidance on it. They're just taking it kind of in their own hands and assuming that, hey, if I'm smoking less cigarettes and I'm smoking more vape pens, then I must be doing better. Not that a clinician actually told them that. So it's usually an eye opener for them when I give them this information, and they usually are very, very appreciative. Another thing that I've noticed too is I'll have patients come in with irritability, mood swings, increased appetite, and the parents think that I don't know what's going on with my child. I know that they're not doing drugs. Only to find out that they had been, vaping, and I guess their supply got cut off. So what you're actually seeing is nicotine withdrawal. So that's kind of a assessment that kind of slips under the radar, even amongst clinicians, because you wouldn't think much of it. Like, oh, okay, these symptoms seem similar. They might get misdiagnosed as having a mood disorder, when in reality they're just going through nicotine withdrawal. So it's been interesting what I've seen in practice, but it doesn't seem like there's any less interest in vaping than there was before.
So our team now learns that it's more complicated than they thought. The family learns this. How do we help them stop, especially if they're presenting this nicotine withdrawal? How do we help them through that?
Well, we actually put them on FDA approved, right? And I'm not sponsored by the FDA or any type of pharmaceutical company, just putting that out there. But we will change them to FDA approved products depending on their age. There are medications to help someone come off of something that they are using there's actually called nicotine replacement therapy, and they have some that are age appropriate for our teens. So we will usually switch them. There's lozenges, stuff like that. There's also other programs that are available to help them. We know that our teens love to text, right? They love texting. And there's actually a quit vaping service for teens that provides coaching by text message. They also have it by phone or even by online chat. And I think you guys have that information. They'll probably post that for you guys. And there's even a number that you can call, like the 1-800-QUIT-NOW, that national number, that does offer nicotine replacement therapy and counseling, and some either at a reduced cost or for free, depending on, your situation. That's available too. So I think they'll provide that also in the chat of the various different resources, and just flipping the switch, right? And making it cool to not engage in this, right? Because the teens are very influenced by their peers. So if we can flip the switch and say, hey, this isn't as cool as we thought it was, that would be helpful too. But there's so many different ways, different programs out there that help to support teens that want to quit. And again, can you imagine being in a peer support group with other teens that are like, oh, I'm trying to get off of it. I don't like the way it feels when I'm out of my supply, right? It's encouraging to be around other peers and other people that are saying like, hey, it's okay. We didn't know either, right? And then, like I said, there are nicotine replacement therapies that are FDA approved. And particularly for teens too, that are useful and are effective.
I've learned a lot. I thought I knew what I needed to know about vaping, but I've learned so much more. I hope that everybody else who's watching has learned too. And it's a lot of information. So if we only remember one thing from this conversation, what should it be?
Well, aside from the one joule pod equals a pack of cigarettes, is that life is so, I always say life is so up and down, right? Life is so fluid, right? Things change all the time, right? So the information that I'm giving you is what we know currently, right? And even in the paper that I wrote with my colleagues, we even say that one of the biggest issues is we do not know the long-term effects. We know what are the issues in relationship to the ingredients. We know that how harmful those can be, but can you imagine it's the long-term effects that we're going to be worried about, right? It's okay, I'm a child, but then by the time I become a young adult or I become a middle-aged or, an older adult, what am I going to be seeing? What am I predisposing myself to thinking that it was harmful, right? And as research progresses and as we learn more, I mean, we can apply that to many other avenues of healthcare and other avenues of science, right? That we thought, hey, this was okay, until we actually did more research on it, did a lot more long-term studies, and realized, oh, it wasn't okay. So if you take away anything, again, I'm not trying to bash any type of company or any type of e-cigarettes. I'm not being paid by anybody, but I do believe in the power of knowing, being knowledgeable about such things, so that you don't, go into this blindly. And like I said, what I've noticed in practice is a lot of parents and teens were just not aware of what it consisted of, or what all of this involved, and the social, environmental factors that all play a role into the use of these substances that are actually big money, or big money for those companies, right? So if we're going to engage in these, you need to be aware of what those potential harms and risks can be. And then again, keep your eye out in the news, keep your eye out in the research, and see what else keeps coming out, and be aware of that. So that's what I would say.
Thank you. Stephanie says, that was amazing. So much info. Should be required watching for all parents. I agree, Stephanie. Thank you so much, Marie. This was very helpful and timely, as you say, with the FDA announcement.
Yes.
I appreciate you taking the time to spend with us this morning. I want to thank our audience for being with us, and to remind them that if you like this, you're going to love Thursday, the Inside Scoop with Sue, when she is interviewing somebody else on a topic that will be of equal interest to you. So join us then. It'll also be 10:30 a.m. Eastern Time on the same social media platform that you're watching right now. Thanks a lot. Again, Marie, thank you for your time.
Thank you so much for having me. It's been a wonderful morning. Thank you, guys.
You're welcome.
All right, bye.